61. A male client is admitted with a spinal cord injury at level C4. The client asks the nurse how the injury is going to affect his sexual function. The nurse would respond: normal sexual function is not possible. B. Sexual functioning will not be impaired at all. C. Erections will be possible. D. Ejaculation will be normal. 61C. Erections will be possible. Because they are a reflex reaction, erections can be stimulated by stroking the genitalia. 62. An 82-year-old client complains of chronic constipation. To improve bowel function, the nurse should first suggest: A. Increasing fiber intake to 20 to 30 grams daily. B. Daily use of laxatives. C. Avoidance of binding foods such as cheese and chocolate. D. Monitoring a balance between activity and rest. 62A. The incorporation of high fiber into the diet is an effective way to promote bowel elimination in the elderly. 63. The unlicensed assistive personnel, UAP, reports to the nurse that a client with cirrhosis who had a paracentesis yesterday has become more lethargic and has musty-smelling breath. A critical assessment for increasing encephalopathy is: A. Monitor the client's clotting status. B. Assess upper abdomen for bruits. C. Assess for flap-like tremors of the hands. D. Measure abdominal girth changes. 63C. Assess for flap-like tremors of the hands. A client with cirrhosis of the liver who develops subtle changes in mental status and has a musty odor to the breath is at risk for developing more advanced signs of encephalopathy. 64. A client is admitted with a diagnosis of nodal bigeminy. The nurse knows that the atrioventricular AV node has an intrinsic rate of 60 to 100 beats/minute. B. 10 to 30 beats/minute. C. 40 to 70 beats/minute. D. 20 to 50 beats/minute. 64C. 40 to 70 beats/minute. The intrinsic rate of the AV node is within the range of 40 to 70 beats per minute. 65. A client is admitted for a possible pacemaker insertion. What is the intrinsic rate of the heart's own pacemaker? A. 30 to 50 beats/minute. B. 60 to 100 beats/minute. C. 20 to 60 beats/minute. D. 90 to 100 beats/minute. 65B. 60 to 100 beats/minute. This is the intrinsic rate of the SA node. 66. A client is diagnosed with gastroesophageal reflux disease, GERD. The nurse's instruction to the client regarding diet should be to: A. Avoid all raw fruits and vegetables. B. Increase intake of milk products. C. Decrease intake of fatty foods. D. Focus on 3 average-size meals a day. 66C. GERD may be aggravated by a fatty diet. A diet low in fat would decrease the symptoms of GERD. Other agents which should also be decreased or avoided are cigarette smoking, caffeine, alcohol, chocolate, and meperidine, Demerol. 67. The nurse is teaching a client with chronic renal failure, CRF, about medications. The client questions the purpose of aluminum hydroxide, Amphogel, in her medication regimen. What is the best explanation for the nurse to give the client about the therapeutic effects of this medication? A. It decreases serum phosphate. B. It will reduce serum calcium. C. Amphogel increases urine output. D. The drug is taken to control gastric acid secretion. 67A. It decreases serum phosphate. Aluminum binds phosphates that tend to accumulate in the patient with chronic renal failure due to decreased filtration capacity of the kidney. Antacids such as Amphogel are commonly used to accomplish this. 68. The client with goiter is treated with potassium iodide preoperatively. What should the nurse recognize as the purpose of this medication? A. Reduce vascularity of the thyroid. B. Correct chronic hyperthyroidism. C. Destroy the thyroid gland function. D. Balance enzymes and electrolytes. 68A. Potassium iodide solution, or Lugol solution, may be used preoperatively to reduce the size and vascularity of the thyroid gland. 69. A client with testicular cancer has had an orchiectomy. Prior to discharge, the client expresses his fears related to his prognosis. Which principle should the nurse base the response on? A. Testicular cancer has a cure rate of 90% with early diagnosis. B. Testicular cancer has a cure rate of 50% with early diagnosis. C. Intensive chemotherapy is the treatment of choice. D. Testicular cancer is usually fatal. 69A. With aggressive treatment and early detection/diagnosis, the cure rate is 90%. 70. The nurse is caring for clients over the age of 70. The nurse is aware that when giving medications to older clients, it is best to A. Start low, go slow. B. Avoid stopping a medication entirely. C. Avoid drugs with side effects that impact cognition. D. Review the drug regimen yearly. 70A. Due to physiological changes in the elderly, as well as conditions such as dehydration, hyperthermia, immobility and liver disease, the effective metabolism of drugs may decrease. As a result, drugs can accumulate to toxic levels and cause serious adverse reactions. 71. The nurse enters the room of a client diagnosed with COPD. The client's skin is pink, and respirations are 8 per minute. The client's oxygen is running at 6 liters per minute. What should be the nurse's first action? A. Call the healthcare provider. B. Put the client in Fowler's position. C. Lower the oxygen rate. D. Take the vital signs. 71C. In clients diagnosed with COPD, the drive to breathe is hypoxia. If oxygen is delivered at too high of a concentration, this drive will be eliminated and the client's depth and rate of respirations will decrease. Therefore, the first action should be to lower the oxygen rate. 72. A client has an order for antibiotic therapy after hospital treatment of a staph infection. Which of the following should the nurse emphasize? A. Scheduling follow-up blood cultures. B. Completing the full course of medications. C. Visiting the provider in a few weeks. D. Monitoring for signs of recurrent infection. 72B. In order for antibiotic therapy to be effective in eradicating an infection, the client must complete the entire course of prescribed therapy. When findings subside, stopping the medication early may lead to recurrence or subsequent drug resistance. 73. A 55-year-old woman is taking prednisone and aspirin, ASA, as part of her treatment for rheumatoid arthritis. Which of the following would be an appropriate intervention for the nurse? A. Assess the pulse rate Q4 hours. B. Monitor her level of consciousness Q shift. C. Test her stools for occult blood. D. Discuss fiber in the diet to prevent constipation. 73C. Both prednisone and ASA can lead to GI bleeding, therefore monitoring for occult blood would be appropriate. 74. A client is prescribed an inhaler. How should the nurse instruct the client to breathe in the medication? A. As quickly as possible. B. As slowly as possible. C. Deeply for 3 to 4 seconds. D. Until hearing whistling by the spacer. 74C. The client should be instructed to breathe in the medication for 3 to 4 seconds in order to receive the correct dosage of medication. 75. After surgery, a client with a nasogastric tube complains of nausea. What action would the nurse take? A. Call the healthcare provider. B. Administer an antiemetic. C. Put the bed in Fowler's position. D. Check the patency of the tube. 75D. Check the patency of the tube. An indication that the nasogastric tube is obstructed is a client's complaint of nausea. Nasogastric tubes may become obstructed with mucus or sediment. 76. A 72-year-old client is admitted for possible dehydration. The nurse knows that older adults are particularly at risk for dehydration because they have A. An increased need for extravascular fluid. B. A decreased sensation of thirst. C. An increase in diaphoresis. D. Higher metabolic demands. 76b. A decreased sensation of thirst. The elderly have a reduction in thirst sensation, causing them to consume less fluid. Other risk factors may include fear of incontinence, inability to drink fluids independently, and lack of motivation. 77. Upon admission to an intensive care unit, a client diagnosed with an acute myocardial infarction is ordered oxygen. The nurse knows that the major reason that oxygen is administered in this situation is to A. Saturate the red blood cells. B. Relieve dyspnea. C. Decrease cyanosis. D. Increase oxygen level in the myocardium. 77d. Anoxia of the myocardium occurs in myocardial infarction. Oxygen administration will help relieve dyspnea and cyanosis associated with the condition, but the major purpose is to increase the oxygen concentration in the damaged myocardial tissue. 78. An arterial blood gases test, ABG, is ordered for a confused client. The respiratory therapist draws the blood and then asks the nurse to apply pressure to the area so the therapist can take the specimen to the lab. How long should the nurse apply pressure to the area? A. 3 minutes. B. 5 minutes. C. 8 minutes. D. 10 minutes. 78b. 5 minutes. It is necessary to apply pressure to the area for 5 minutes to prevent bleeding and the formation of hematomas. 79. A client receiving chemotherapy has developed sores in his mouth. He asks the nurse why this happened. What is the nurse's best response? A. It is a sign that the medication is working. B. You need to have better oral hygiene. C. The cells in the mouth are sensitive to the chemotherapy. D. This always happens with chemotherapy. 79c. The epithelial cells in the mouth are very sensitive to chemotherapy due to their high rate of cell turnover. 80. A client with testicular cancer is scheduled for a right orchiectomy. The nurse knows that an orchiectomy is the A. Surgical removal of the entire scrotum. B. Surgical removal of a testicle. C. Dissection of related lymph nodes. D. Partial surgical removal of the penis. 80b. Surgical removal of a testicle. The affected testicle is surgically removed along with its tunica and spermatic cord.